Hi, my name is Dr. David Knox of Companion Animal Health and Rehabilitation, and we're going to talk a moment about arthritis. Um, Arthritis in dogs is one of the most common things that we see, especially in the knees. The reason for it is that the knee is a very complicated organ where most of the really stable joints are what we call ball and socket joints. The knee is more what I call a ball and table joint, meaning that the bottom portion of the femur is round and then the top portion of the tibia is flat. And so it doesn't create stability. As a result, we have to have a lot of ligaments around the knee to be able to hold it in place. The knee cap sits right in here in the patellar ligament and sits right inside this groove here, right inside that groove right there. And that's what keeps things moving comfortably and normally. However, if we have damage to the knee, for instance, if the cruciate ligament of the knee, which sits right here and connects the bottom bone, the tibia, to the upper bone, the femur, um, it prevents excessive motion of the knee and instability of the knee. When that tears in dogs, it creates a lot of arthritis if it's not handled appropriately. And what that arthritis can look like is it can create, this is a model without the patella and the patellar ligament in place. And this red indicates evidence of arthritis or an area of arthritis that's happening as a result of that knee moving too much back and forth. As that happens and continues to go, it can actually become much more severe where it'll wear off all the cartilage on that knee and create a lot of pain. The knee is covered with a periosteum that is very highly innervated and can create a lot of pain when you get to bone-on-bone arthritis, which a lot of people can relate to. If we have that particular problem, there are a number of different surgical corrections that can be made. There are times when surgery is not recommended, but those from are going to be really very limited situations. The most appropriate way to fix that problem is through a surgical correction. Once we have surgery, that's something that you should talk with your veterinarian about as to which type of surgery is going to be best for your pet. Um, and then after surgery, then it's time for rehab, and that's where we come in. And you bring the dog in, or cat, or whatever the case may be, and we will design a rehab program that will likely include underwater treadmill, laser therapy, exercises, other pain control modalities. And our goal is to get your pet back up and as close to normal as we can as quickly as possible. If you have any questions, please give us a call, 760-743-2751.